My name's Dr. Andrea Collins. I work as a consultant in respiratory infection at Liverpool University Hospitals, and I'm also a researcher at the Liverpool School of Tropical Medicine. I've worked in vaccinations, predominantly in pneumococcal vaccinations, in pneumonia vaccinations for over 10 years now, and we've been working in the COVID vaccine field, particularly in the with Oxford, since around April or May of this year. So the vaccine is fantastic news, obviously, for all of our staff and for healthcare workers across the country. It's particularly good, obviously, for the individual. So on an individual basis, it means that if you do get COVID, either from work or through community, that you're much less likely to get severe disease and much less likely to be hospitalised due to your COVID infection. So obviously that has knock-on effects to, the effects on our family and friends of us being severely unwell. It also has huge effects for the NHS in which we all work and for the NHS that delivers the care again to our family and friends. The pressures have obviously been huge of COVID, and so to have less people in intensive care, less people on HDU and less people in the hospital in general with COVID infection means that we can get on with normal services much more, so the cancer services that have been delayed and somewhat, and a lot of the other elective care services can carry on like normal. It also means that in general, just our general work pressures will be reduced slightly, hopefully. Should be less people and less colleagues off long-term sick, which means that the just general work pressures should be reduced. The vaccine is great news for the general population because it protects them from also getting severe disease and from being hospitalised from COVID. It means that those people that we're shielding are more likely, hopefully if they do respond to the vaccines, to therefore be protected as well. It means that our NHS is more protected as well, which is great for the general public. Unfortunately, the vaccine rollout does not mean that we can relax with the measures of social distancing, hand hygiene and face mask wearing that we've all become quite accustomed to. The vaccine will not be 100% effective because no vaccine is. The efficacy, to be fair, of the vaccines is fantastic, but it's not 100%. There will also be people in the community that cannot be vaccinated for whatever reason or choose not to be vaccinated. And there will be people that have been vaccinated that are not protected, that have not mounted a protective immune response due to the vaccine, so we are not all protected. The vaccine also, unfortunately, doesn't protect against us being transmitters or carriers of COVID, so we may not know we've got any symptoms and be spreading it around, so that's why those measures are still really important. So Liverpool University Hospitals has been really at the centre of the developments with the vaccines locally. So Liverpool School of Tropical Medicine led the Oxford vaccine study and was supported by Liverpool University Hospitals and also the National Institute of Health Research locally, which is called the local CRN. And that partnership worked together to deliver the Oxford vaccine. We were the top recruiting site in the major groups of the vaccine study that is due to be published soon across the whole of the UK, which is a fabulous achievement, and we're the only site in the Northwest as well. So it was a fantastic opportunity for us at LSTM and Liverpool University Hospitals to be able to vaccinate the healthcare workers across the Merseyside patch and for them to have the opportunity to be involved in this study. So the normal process for developing a vaccine is not dissimilar to this normal process in many ways. The safety is absolutely paramount throughout the process. Vaccine studies normally take a number of years because they work through a sort of set process which goes from preclinical studies, which are animal models, all the way through to early phase studies, and they're called clinical studies that are in humans. And that will be a phase 1, an early study, phase 2, through to phase 3, which is the current Oxford vaccine study, for example, that we've been running. And that's normally about efficacy, so seeing if the vaccine is safe but also effective. The earlier phase studies are about safety, really, and getting the doses right. Now, that process normally takes between 6 and 10 years, and that's for a vaccine that works. There will be many vaccines along the way that basically just make it through a couple of the stages and then get canned to one side. So the fact that we've managed to get any of these vaccines through this process so quickly is just fantastic. So this vaccine has been developed so quickly due to a combination of collaboration and good science. So The collaboration is basically everyone pushing in the same direction. So normally, if you were going to go through the regulatory processes, so the research and ethics committees, the MHRA, or whichever regulatory authority for drugs you might use, so in America that'd be the FDA or the EMA for Europe, everyone has been pulling in the same direction. And rather than you waiting in a queue to maybe get 90 days to get a response each time you need to change something, everything has been happening super quickly. So it's at the forefront. So that's one of the reasons that it's gone through so quickly. They've also had no safety issues, so there hasn't been a need to sort of stop, go back, rejig things, etc. You know, it has been a very smooth process with everyone pulling in the same direction. We can be assured that the vaccines are safe to use because they have gone through intense clinical studies that have been run according to very high regulatory standards. So we know that they have been run very safely and very efficiently, and these vaccines are safe. We can be sure that this vaccine is effective because the data is really very good. Any vaccine that has efficacy above sort of 60 or 70% is really pretty good. Some years the flu vaccine has looked to have, pretty poor efficacy and protection, so efficacy meaning protection, well below 50%, but we still use it. We know that other vaccines are like that. So really this is a really kind of very protective vaccine. I think the main thing to say is that it does protect against severe hospitalisation and therefore death, but it doesn't necessarily prevent you getting COVID at all. And we do know that people can get moderate to severe COVID where they might not end up in hospital, but may end up with long COVID as it's now termed, or the long haulers. So it still means that it hasn't gone away entirely, but it is good news. In my opinion, this vaccine is safe, effective, and I would recommend all healthcare workers and vulnerable people to make it their priority to get themselves vaccinated with one of these COVID vaccines as soon as it is offered to them.